Um, if you could access any 10 data points, including results from any medical test, detailed information on an individual's diet or exercise habits, levels of any mineral or vitamin, cholesterol levels, blood sugar levels, salt intake, etc., which would you choose as the most crucial to predict which among a group of 1,000 40-year-olds are likely to maintain good health until 95 years old?
Do you want to go first?
No, go ahead.
Okay.
I feel like I say I get a little carried away sometimes.
Got it. So
I'll
it's
give you a
hard
short
just
answer for this.
already. It's wow. It's like you're giving us a all these choices. So one test that I find from studies is associated with longevity is a test called the VO2 Max, where you have a patient exercise, and it's kind of a technical term, but it measures the efficiency of the human body as basically an engine in terms of extracting oxygen and producing carbon dioxide and energy, and what is the maximum level of energy. And so it's basically an exercise test. So people in the top 10 percentile of VO2 max, that's associated with much longer survival. Another test I would like to look at to measure longevity would be hemoglobin A1C. And then the third, hemoglobin A1C looks at the long-term over the last 3 months, their glucose control. And we know that people with increased glucose blood sugar levels often have insulin resistance, which again is associated with chronic diseases and early death. And let's see, picking one more test associated with longevity, I would look at blood pressure, because we know that people with high blood pressure unfortunately often die prematurely. So I would choose these three tests: the VO2 max exercise test, the hemoglobin A1C, and people's blood pressure.
Thank you.
I think all of those are valid, but there's only one test I consider always to turn out to be highly predictive, and that's compliance. In other words, how well a participant adheres to the diet. I don't care what happens to their cholesterol. I really don't even care what happens to their blood pressure. It's how well they stick with the program. And Dean Ornish has shown that, for example, when he saw reversal of atherosclerosis, there was no correlation with cholesterol. It was adherence, compliance with the program. That's the only factor. I mean, if you had to narrow it down what you're asking me to do, that's what I would choose, is compliance to the program. Now, Steve, I hate to interrupt here, but I saw down in the chat, somebody said that Dr. McDougall took vaccinations. Let's make sure we cover that during this session, okay? I want to deal with that.
Okay. Okay. What specific advice do you have for patients looking to lower their blood sugar to below 100 or below 90?
You're asking what can people do to lower their blood sugar?
What specific advice would you say to someone who's trying to get their blood sugar below 100 or possibly even below 90? What would be your specific advice?
Well, first of all, I would take a step back and look at nuance, because I think what you might be referring to is their fasting blood sugar.
Yes.
Yeah, because obviously if I eat a potato right now, my blood sugar is going to go up above 90 or 100, which is normal. Insulin's going to come out and bring it down. So the things that people can do to lower their fasting blood glucose or blood sugar is to focus on lowering levels of inflammation, one way they can do that is to decrease the amount of visceral fat, which is the amount of fat around their body. And I would add, the percentage of visceral fat is one of those other tests that I think correlates with long-term survival. You want to bring your visceral fat levels low. It turns out that the visceral fat, the fat that surrounds the internal organs, like the heart and the liver, is a very pro-inflammatory, metabolically active tissue that can cause increased fasting blood sugar. And there's no magic drug that's going to quickly take it away. It's by eating the right diet, by getting exercise and getting the appropriate sleep, basically having a correct lifestyle. All those things can lower your visceral fat levels, which in turn will lower your fasting glucose levels.
Okay, I'll make it simple for you. Lose weight. Okay, type 2 diabetes is 100% curable by losing weight. All right, you can go on the Atkins diet. You can take semaglutides, the new shots used for weight loss. I can lock you up in prison. I can wire your teeth together. I can put you on the McDougall diet. Regardless, if you lose weight, you'll cure type 2 diabetes 100% of the time. If you have type 2 diabetes, if you have type 1 diabetes, you must have insulin. Losing weight following a good diet will help you in tremendous ways, even if you're a type 1 diabetic. And then there's something in between. I call it type 1.5 diabetes. In that case, losing weight may correct it, but it may not. And you might need a little insulin to correct some of the problems. So I can I can make your blood sugar 15 if I want. I'm a doctor. I have pills and shots, and to do it, look, you're not going to cure a type 1 diabetic with any diet. They have to take insulin. Type 2, you cure all the time with weight loss. So that's how you do it. And a good diet is important in every aspect of diabetes or in good health. So don't think I'm overlooking that very fundamental thing, because I'm not.
In terms of cancer prevention, what specific dietary or lifestyle recommendations do you make?
Yeah, so it's interesting. Preventing cancer is similar to the other chronic diseases we've been talking about. Specifically, you want to avoid processed foods. You want to avoid toxins like aluminum and heavy metals. You want to make sure you're exercising. And yeah, so specifically, I would stay away from animal products. I would make sure you're exercising. I would make sure that you limit your being overweight or your visceral fat, because those are associated, being overweight is associated with higher risk of developing cancer. So yeah, cancer as a chronic disease is no different in terms of the prevention, eating the right foods, lots of plants, avoid animal products, and try to lose weight if you happen to be overweight or obese.
I would say don't smoke. And don't catch certain viruses, because there are lots of viruses out there that cause cancer. And avoid environmental pollutants, because I think most of our cancers are initiated by industry and the pollutants that it provides. And then what happens is people become overweight, which promotes cancer. They develop high estrogen levels in their body, which promotes breast and uterine cancer, by eating the Western diet. So clearly, the best diet for preventing, as Dr. Helman said, because of the chemical accumulation as you go up on the food chain. All right, that's how you get most of these carcinogenic chemicals, is when you eat at the top of the food chain, which Dr. Helman was just telling us about. So diet helps you in many ways. But I want to add one more thing, is diet is even helpful when it's not a cancer that is obviously due to diet. Like, for example, when it comes to lung cancer, In Japan, 60% of the males smoke, far more than males in this country. Yet in Japan, they have a much lower incidence of lung cancer, even though they smoke more. Why? Because they eat a diet that allows them to defend and repair better than we can. So diet influences smoking cancers, skin cancer. An article published in 1992 in the New England Journal of Medicine. They looked at people who had skin cancers, actinic keratoses. And what they did is they put them on a low-fat diet. They reduced the recurrence of actinic keratoses by 2 to 6 times. So a good diet's going to help you from every aspect of cancer. Viruses, toxins from smoke, sun damage, all kinds of things that you've worked really hard at avoiding, which you should still avoid. But you've got to have diet as a fundamental way to not only prevent, but after you get cancer, you will live longer if you eat well. February 13th, 2015, you look it up. The American Cancer Society came out and told doctors, February 13th, 2015, told doctors that you should be prescribing a healthy diet in the direction we're talking about, you know, condemned meats, et cetera, eat more plants, et cetera. They said, the American Cancer Society said, you should eat that diet. Doctors should tell patients to eat that diet after they got cancer. But of course, it's been 9 years, they haven't done it, as far as I know. So, you know, it's not only prevention, but it's treatment. And I believe you can change the course of cancer by being healthy. I mean, not everybody dies in 2 years. Some people live 20 years. Why? Why? Well, I would think a sick person would be more likely to die in 2 years, and a healthy person would be more likely to live 20 years, wouldn't you think? I do. I do.
Fasting at the True North Health Center, what types of fasting do you recommend, and what are the health benefits associated with them? Specifically, are you recommending fasting for intermediate fast, just fasting from dinner till breakfast? Are you recommending a 3-week fast at True North Health? Are you recommending a week fast, a 3-day fast, a juice fast, a water fast? What is the specific recommendations you're recommending on fasting?
Yeah, so my perspective on fasting is that fasting is similar to exercise in that the more you do it, the better you get at it. And also interesting, biochemically, the changes in your body when you fast are almost identical to when you exercise. So wherever you are, I think it makes sense to consider fasting. So if that means if you've never fasted before, try some intermittent fasting. Limit the hours of the day that you eat to maybe 12 or 8 hours. Skip breakfast. Now, if you've got a chronic disease that you're trying to reverse, or you're trying to lose weight, sure, try Dr. McDougall's program. But we would definitely have some patients at True North who unfortunately failed Dr. McDougall's program and got sentenced to fasting at True North. So at True North, the ideal was water fasting, but some of the patients were so sick, you have to be off most medications to water fast. But I think one of the key things is if you're going to water or juice fast, it's best to do it under medical supervision. Now, I've seen people do it on their own, but it's risky, especially the refeeding portion. So in general, when it comes to fasting, I'm a big fan. There are many different types. And I would say start with the type that resonates with you.
Thank you.
I'm a longtime friends with Dr. Alan Goldhammer and True North. And so you'll hear nothing but positive things for me to say. Water fast is the ultimate elimination diet. No cholesterol, no fat, no toxins. And it's the ultimate elimination. Now, whether or not it helps, once you get these toxins out of the system, whether or not the body's more efficient at healing is something that the fasting people believe to be true. I send people from my program to True North under two circumstances. One, and it's usually an autoimmune disease. That's usually what we're dealing with. I will send somebody over it, and believe me, it only happens maybe once every couple of years, so it doesn't happen very often. And the second reason that I would send them over is if they won't follow the McDougall diet. After 10 days of just water, you know, the McDougall diet is a palace. It's the best buffet in town. So if you need any motivation to change what you eat, go water fast for a couple of weeks. Dr. Alan Goldhammer will beat it into you. And by the way, at True North, they serve they teach the McDougall diet without salt and sugar. We include salt and sugar on the surface of the food for the reasons I told you. I want them to eat the food. I want them to like the food. They like salt and sugar. So we put it in small amounts on the surface of the food. You know that Mary Poppins saying? You know what they said Mary Poppins, right? Okay. A little bit of sugar makes the medicine go down. Well, that's what we do.